Andrea, just a minute too. Good afternoon. Let me first apologize for a late start. We had some technical difficulties. But it is my pleasure to welcome you all to this, our first presentation for the semester in the UWI Mona Western Jamaica Campus's Research Seminar. This initiative has become a valuable part of our academic calendar, providing a platform for faculty, students, and members of the wider academic community to share their research, strategies, and innovative ideas. Today, we are pleased to have our presenter, Dr. Stuart Dixon. She's a psychotherapist consultant and clinical supervisor. Dr. Dixon holds a doctorate in psychotherapy and has over 15 years of experience in public health consultancies, having successfully completed more than 55 projects locally and internationally. Her dual experience in psychotherapy and public health provides her with a rich understanding of global health issues and development. As an independent global health consultant and lecturer, she has worked extensively in areas such as HIV prevention, behavior change, and adolescent sexual health. Her portfolio also spans policy analysis, program design and implementation, information communication development, and monitoring and evaluation. In her psychotherapeutic practice, Dr. Stuart Dixon primarily serves adolescents and young adults here at the University of the West Indies, supporting their mental health and overall well-being. Please join me in welcoming Dr. Jennifer Stuart Dixon for her presentation. Dr. Dixon.
Good afternoon, and thank you, Ms. Adua, for a very warm welcome. So I'm here. I was supposed to do this in May, but we're here now. So welcome to my colleagues and to friends online. I'm going to be sharing with you some of my thoughts around what we would want to consider for our global health program, which I know the university is embarking upon in the very near future. So I'm going to be sharing some of my thoughts with you, and I hope that you will participate and be engaged. So today we're going to be exploring some critical considerations for global health program development. I'm going to highlight some of the Caribbean-specific perspectives on equity. And I'm going to be recommending some strategic platforms for sustainable local response programs, okay? Right, so the first thing is, what is this global health, okay? So global health is an area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide, right? So it emphasizes transnational health issues and determinants and solutions, involves many disciplines within and beyond the health sciences, so that really speaks to that multidisciplinary approach, and it's a synthesis of population-based prevention and individual-level clinical care, okay? So it really balances this population-based prevention with individual-level care, and Copeland 2009 speaks to this. All right, so one of the things that keeps coming up in global health is what is equity. And so I wanted to just talk a little bit about equity as the principle that everyone has a fair and just opportunity to achieve their full health potential, okay? So this means that we need to remove the obstacles like poverty, discrimination, lack of access to quality education, housing, healthcare, and all the several other things that we know have a negative impact on access to health. So achieving health equity requires addressing some avoidable and unfair differences in health outcomes between different populations and groups, okay? And so as you can see in that slide, I really like the picture because it really gives us a good idea of what equity is. In other words, not everyone needs the same thing. You see that diagram at the bottom of your screen? Not everybody needs a stool of the same height. Some people might need one, some people might need two, and some people might need three. And therefore, that's what equity is. It's giving people what they need to be healthy. Now, so here's another picture that kind of brings the difference between what this idea of equity and equality looks like. So when we're talking about health equality, everybody's getting the same services, clinic opens at the same time, okay? And it's kind of a one-size-fits-all approach. But when we're talking about health equity, everyone gets the resources that they need. That means that clinics might open for our adolescents at a different time and may take into consideration people that work. And therefore, we have to make some allowances for that. So that's what equity is, okay? So it acknowledges different starting points and barriers for different people and focuses on fair access to achieve better health outcomes. Okay, so, you know, there's a lot of terms out there: public health, international health, global health, and it becomes very different to determine where one starts and where one ends. And there's a lot of overlap. So this is my best attempt at trying to bring some clarity to that matter. So the definition at best is that public health is more of a focus on health population within a specific community or country, okay? While international health now is looking more at low and middle income countries, and often there's a lot of external assistance involved in that kind of service. But a global health approach now focuses on health issues that transcends national boundaries and requires a more global input and cooperation to address those issues. So I'm not going to go into every one of these issues on the slide, but let's just look at collaboration, for instance. Public health is talking about local governments, our health departments, our schools, our communities, while international health might be looking at our donors, our USAID, and we have a lot to say about that later on in the presentation, and our NGOs. But when we're speaking about global health, it's wider. We're talking about those multinational partnerships, those global agencies. Academia is involved, which is why we're having this discussion today, and civil society. So some of the issues that public health might be looking at, and as I said, this is not cut and dry. Some things are a bit blurred. Tobacco control in a city. International health might look at malaria issues in Sub-Saharan Africa, and global issues are looking at more pandemics like our COVID-19 when we were addressing that. But the main goal of public health is really to improve population health and prevent disease locally. International is looking at providing health aid and resources and services to lead less resourced countries, and global health is improving health equity for all the people of the world. Okay, so next slide. All right, so I wanted to talk a little bit about the social determinants of health, because remember when we were talking about we were talking about inequity and what are some of the things that can lead to inequity, and the social determinants is a good framework for that, because when we're talking about the social determinants of health, they are the conditions in which people are born, live, grow, work, and age that shape health. Social determinants of health include factors like, as you can see from the slide, socioeconomic status, employment, social support networks, as well as access to health services. So therefore, we need to address these social determinants of health because it will allow us to improve health and reduce long-standing disparities that occur in health and healthcare. So we're talking about healthcare access and quality, access to healthcare, access to primary healthcare, health literacy. All are some of the things that contribute to whether a person have access or are accessing health inequitably. Thank you. Another set of factors that we need to consider around things that impact people's ability to access health services and have healthy outcomes are some of the structural determinants. We're talking about what kind of policies exist in our countries. We're talking about our social policies, our public policies. We're talking about cultural and social values. For example, a structural determinant, such as a lack of affordable housing policies, leads people to living in poor neighborhoods, right? And with inadequate infrastructure, which can have poor air quality. And someone with poor air qualities is likely to have more health-related issues. Yes? So, the sustainable goals, the Sustainable Development Goals were really brought on board to ensure that we could all be achieving this call to action to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity. It's one way to kind of set an agenda so we can all be working on the same thing so the world can be enjoying good health. So the Sustainable Goals were adopted by the United Nations member states in 2015, and it's a call to action to end poverty, as I said, protect the planet, and ensure that all people enjoy peace and prosperity. There's 17 Sustainable Development Goals, and the area of health is really on Goal 3. So the pledge is that no one gets left behind. So countries have committed to fast-track their progress for these furthest behind first, so the countries that are furthest behind. And this is why the SDGs were designed to bring the world to several life-changing zeros, yeah, including zero poverty, zero hunger, there's one zero AIDS, and discrimination against women and girls. Sorry, there we go. Yeah. So, how are we doing on these Sustainable Development Goals? Because this is really an indicator of, how well our country is doing. So, as you can see, I circled health there because, we're talking about global health, and as you can see, we're stagnating, right? So we really need to do some work in making sure that we are meeting those goals. So what are we not doing too badly in? On track, 17 partnerships for the goals, okay? But as you can see, in most, we're not doing too bad in, what's 9? Industry. We're not doing too bad in industry. This was an amazing dashboard to have a look at, and I suggest that you check it from time to time if this is something that you're interested in. Gender as well, we're doing well on gender, wonderful. Okay, great. So, a couple things are happening why we're not being able to have more lines in green heading up, like some changes in our health landscape, okay? Let's say this, we don't have to talk about the decline in foreign aid, right? Everybody knows that in March 2025, there were significant cuts. Yes, Trump came into power, and a lot of things changed. A lot of donor programs shut down, and there was a lot of uproar. But I want to tell you, it didn't just happen in the United States, because it also happened in Europe, because in the UK shaved the foreign aid debt by 0.5% of gross national income. And France had some reductions by 35%, and Switzerland also shut down some development initiatives. So this isn't just a Caribbean issue, it's a worldwide issue. And it's an issue that as a program that is going to be talking about global health, that we are going to have to train our graduates to be addressing these kind of problems. How are we going to fill the funding gap? Because there is a gap in the amount of funds that goes into our health services from our ministry and from our public partners. There is this donor gap that needs to be filled. Right, so another change in landscape. Okay, I think I just spent a little bit more time talking about the Jamaica cut percentage country program 73, and that works out to $11 million US. Do you know how many development programs have been impacted as a result of that? which means that there are people out there that's not having access to services. One of my areas of specialization is HIV prevention, and I know that quite a few HIV projects have been impacted. Our own Health Connect on the University of the West Indies has closed. Okay, this is real, people. All right. Now, we also have quite a bit of change in climate on Earth, and I know you have noticed, and Prof is here shaking his head, that the Earth's surface temperature has warmed 1.8 Fahrenheit since 1850. And so what does that mean? Increased weather conditions, increased humidity, increased rainfall. We see that here in the Caribbean. We've noticed how much hurricanes are coming by and the intensity of these hurricanes, as well as how hot it's getting, the drenching rains, and the severe floods, drought, and wildfires. Okay, so, and just to be a little bit more specific about what's happening in the Caribbean, just the increased amount of earthquakes and as well as landslides, floods, hurricanes, drought, an average economic loss of $1.6 billion. So we have to be thinking about all of these issues, because all of these issues lead to health. And when we're thinking about developing a global health program, we have to make sure that our graduates understand all of this so they can negotiate for us on the stages that allow us to be partners and included. So when all of these climate things are happening, how does it impact health? Well, as the temperatures rise and there's severe weather, there are fatalities, and people suffer from extreme mental health conditions as a result. When there is extreme heat, there are heat-related death, cardiovascular issues. When there is increased carbon dioxide in the air, there is environmental issues. Water and food supply are impacted, which contributes to malnutrition and diseases. So there's just a whole lot of impacts from these changes to health, and global health is the area that needs to be keeping an eye on all of these areas and determining how are we going to make changes, how are we going to put in policies, how are we going to change our laws to ensure that we're not impacted adversely. Another set of changing health conditions is the global burden of disease. There's a decrease in communicable diseases of neonatal deaths, however, an increase in non-communicable diseases and mental health, especially since the pandemic, yes? And therefore, there have been changes to our health systems to accommodate these presenting issues. There's an increase in mental health screening now. Once upon a time, you'd go into a hospital and they weren't screening you for anxiety and depression. Now they are. Yeah, and there is a scale up of the primary care to support the increased screening. Some other information about the global burden of disease, which is a study of global research program that quantifies health loss due to disease, injuries, and risk factors for Jamaica, heavily influenced, as I said, by non-communicable diseases, with cardiovascular disease, diabetes, and cancers being the top 3 causes of death and disabilities. Non-communicable diseases, along with other non-communicable diseases, account for the majority of health life lost, while mental health disorders, self-harm, and violence also contribute significantly. Okay, another concern is the demographic changes in our population. An aging population, 60 years and over, is growing faster than the overall population, and therefore we need to have changes in our approach to health. We have to look at frameworks that go across the lifespan and ensure that persons at all stages of their development are seeking services and getting support. So the life course approach focuses on understanding how early life experiences and events influence an individual's health and well-being throughout their lifespan. Simultaneously, the ecological approach emphasizes the interconnectedness of individuals, their environment, and their social system, recognizing that these factors interact to shape outcomes. So, a lot of changes that our health system needs to incorporate. Then we have a challenged health system. The primary healthcare approach is what is being utilized, and it is a comprehensive community-based model on delivering accessible, continuous, and coordinated healthcare services to individuals and communities. Okay? The philosophy is that it emphasizes prevention, health promotion, and managing a broad range of health needs rather than solely focusing on treating specific illnesses. The approach is crucial to us achieving the universal health coverage, which is ensuring that all people have access to high quality services without suffering financial hardship when paying for them. WHO has introduced these 6 building blocks to ensure strong health systems, and they speak to service delivery, health workforce, health information systems, access to essential medicines, financing, and leadership and governance. The interconnected components are essential for delivering effective, equitable, and sustainable health care. And again, pointing to areas where our graduates need to be trained in to ensure that they can ensure that we have a health system capable of dealing with whatever comes our way. So we know that there's a migration, and our healthcare providers are leaving for greener pastures, yeah? And albeit that there are agreements to facilitate a movement, there's a Cuba-Jamaica agreement, we have Cuban doctors here, and there's a Nigerian-Jamaica agreement, there's a Ghana-Jamaica agreement. People are still leaving, and how does this impact our services? Well, let me tell you how it impacts our services. It impacts our services when you go to the hospital and you don't have enough doctors on call, and you have to wait a very, very long time in A&E before you can be seen. Yeah? It affects us when you go to the clinic and you can't get an appointment for a surgery or for something for 2 months, right? This is real. We can understand people leaving for greener pastures, but we need to fix our system to make it, good to live here and earn enough to be able to stay on our shores. Changing landscapes. Oh yes, there's the digital health options and the use of telehealth, AI, mobile apps, and all of that again is changing the Caribbean landscape. And all of these changes need to be fed in to what our global health program needs to look like. Okay, so in trying to ensure that we get back on track with those sustainable development goals, remember that diagram? We said we weren't doing so well? Okay, so the WHO has introduced a global strategy, a global health strategy for 2025-2028. And it is really, as I said, to get us back on track with those sustainable development goals. Okay? I'm going to just really focus on 1 to 6. And if you can see, 1 is about responding to climate change, and we outlined the challenges that comes with climate change. The second one is determining those determinants of health. Remember, we had that whole discussion about the determinants of health. And the third one is the primary healthcare approach and essential health systems capacity. 4 is about how do we continue to improve our coverage of health services and our financial protection, particularly with all the reductions in aid. 5, to prevent, mitigate, and prepare for health risks and hazards. And we don't want to go back to a time of COVID-19. And we want to 6, rapidly detect and sustain our response to health emergencies. Can I have a time check? Okay, thank you. So when we're looking at the UWI MONA Global Health Program, Really, there's a nursing, medical, imaging specialist, pharmacy, nutrition, dentist, and physical therapy. Now, since medical care significantly contributes to improved health outcomes in Jamaica, particularly through prevention, management, and control of disease, leading to improvements in life expectancy and reduction in infant and under 5 mortality, professional training will focus on these disciplines. However, we would really like to see a shift to more root causes and understanding what those are, and facilitating educational programs that adhere to those objectives. So, there were some questions on the side of the table, and I'm going to address them now. So the way forward in the light of funding cuts. How to sustain critical health services amid dwindling international and local support and the demand for services. I'm thinking that that's going to be one of the major things that our graduates of our global health program will need to be working on. And I propose that it's about self-reliance. Yeah? How do we rely on our own powers rather than those of others? And that is really going to be, we need to explore innovative funding sources, a range of financial products, guaranteeing innovative funding is going to be central to this pursuit of the Sustainable Development Goals. And a South cooperation, Global South leadership, which is a framework for collaboration among developing countries in the Global South to exchange knowledge, skill, and resources to achieve shared development goals. This form of cooperation kind of empowers countries to create their own solutions to common challenges such as climate change and health and human rights. So instead of a North-South cooperation, which involves really high-income countries, the global North, providing assistance to low-income countries, we're wanting to move away from that kind of cooperation. So, some points to consider in relation to representation and funding is that donors come with an agenda, and it really dominates and often not sustainable, and I think we're really finding that out now. Caribbean nations face systemic funding challenges due to their small size, and equity in global health requires structural change and stronger regional representation. We have to make our voices heard. We have to let people know about our context. And you know, this brings me to a personal example that I'll share with you. I have had the privilege of contributing to HIV global guidelines, and during those meetings, you know, some of the things that they proposed, I remember standing up and saying, that's not really going to work in our setting. It's not going to be practical. And being able to give some justification and rationale as to why this may not be such a good idea for our context really allowed persons to think differently and to adjust the guidelines. And therefore, this idea of regional representation or stronger representation, I'd like to see our graduates, you know, be a part of these guidelines development groups, making sure that the issues of our context are represented. So, how do we transform, finance, deliver health services, and advocate for change? Well, an understanding of the global inequities, all of those slides that we talked about before, the Sustainable Development Goals, understanding the inequities, particularly from a Caribbean perspective, talking about these Global South issues and pulling our partners together, discussing economic and trade imbalance and debt burdens and tariffs, and having people having our students understand that these foreign debt investment is often concentrated in our tourism and bauxite, which doesn't necessarily benefit our local communities equitably. So being able to have that kind of information and have that kind of discourse. Understanding what we talked about regarding our increased prevalence of NCDs and our increased exposure to mental health challenges, recognizing the impact of this brain drain on our health system, and recognizing that globalization strains the local health systems. As I said before, moving to greener pastures does create shortages in our home countries. Understanding the digital divide, there's a gap between those with or without access to effective use of digital technology. So including the internet devices and digital skills, this dependence on foreign aid, foreign curriculum. We need to start writing our own testing standards where we're not represented. Limited access to innovation, cybersecurity, and data sovereignty. Now, this one is interesting for me because it is a concept that digital data is subject to the laws of country or jurisdictions in which it is collected, processed, or stored. So when we use these databases, do we own the data? Can we manipulate it? These are just some of the questions that we need to ask. And to recognize, again, our climate vulnerability and our resource exploitation, understanding of the remittance dependence. And that one is so interesting because, again, there's been some changes in regards to taxation being put on remittances, and how that continues to affect funds coming into the country and funds that we can be using for the health of our communities. So I wanted to look at the 6 general program of work and begin to make some recommendations for our programs around those areas. So we can just move on to the first one. Respond to climate change and escalating health threats. A focus on health implication for the climate change impact. Climate-sensitive diseases are illnesses whose incidence, intensity, or disruptions are influenced by climate. And so these are pieces that need to be included in our curriculum. Disproportionate impact in particularly vulnerable areas, including our small island states. When we're looking at climate change in public health practice, how important partnerships are, partnerships with our various ministries, working with our agricultural ministry on food security, partnering with education ministers for public health education, collaboration, and environmental agencies for air quality. We have several partners. We have Pan American Health Organization, we have CARFA, we have Caribbean Community Climate Change Agency, we have WHO. We need to be getting all our partners on board to help us with policy development, health impact assessments, health education, surveillance, and preparedness planning. Address determinants of health and root causes of health. Focus on research and health literacy. We need to promote culturally appropriate, locally driven health strategies and health research. Health literacy, social justice, equity, for examples, include plain language, easy to understand, and addressing the social determinants of health through community engagement and policy. Teach strategies to promote health literacy, social justice, and equity. Advance the public health approach and essential health system capacities for universal health access, health information system improvements or re-engineering. I think we have a lot of work to do in those areas. We need to be putting out the essential health information for our region to be able to implement policies that can strengthen our health system. Health system, improve health services coverage and financial protection focus on our economic context. Our students really need to understand how debt to GPT ratio affects the following: our credit worthiness. Credit rating agencies may downgrade the country, leading to even higher rates of interest when we're borrowing. Conditionalities from lenders, it means a large proportion of government revenue must go to debt servicing rather than in development. Point 3, to the fiscal flexibility and social spending. High debt limits how much government can spend on social programs. And so once again, our graduates would need to have this information or understand this context to be able to negotiate on our behalf. Prevent, mitigate, and prepare for health risk from all hazards. Again, partnerships, global health policies in all sectors, education, tourism, or Minister of Labor, Agriculture, all having policies that look at health and the impacts of the various climate change and how it impacts health. Rapidly detect and sustain response to health programs, again, through understanding the donor responsiveness. I won't go into that in too much detail. Partnerships, strengthen collaboration with these agencies, global policy influence, funding acquisition. Countries could also increase their financial base by embracing innovative funding and mechanisms, including blended financial and public-private partnerships where appropriate social impact bonds to mobilize new resources. So we're really going to have to understand the arena of funding and access to funding. Again, I mentioned South-South linkages. How do we involve places like Latin America and Mexico, recognizing that there's language barriers, but nonetheless, we have to work with our partners who are experiencing the same challenges that we are. We have to ensure that monitoring and evaluation of all programs and our systems and policies, we have to be determining what is it that we're going to measure and how will we measure it. So winding down with, critical areas for processing, we need to examine global health governance structures, understand who holds the power in global health decision making, and how Caribbean voices can be more represented. Identify barriers to equitable funding access, discuss systematic challenges faced by Caribbean nations and small island states in accessing global health funding, explore innovative funding strategies, highlight successful approaches used by other countries and organizations to mobilize financial resources for health initiatives, strengthen advocacy and representation, equipped participants with tools to advocate for greater Caribbean visibility and participation in global health funding, foster regional collaboration, promote partnerships among our stakeholders, and improve collective bargaining and proposal success rates. How am I with time? I'm out of time. I have 5 minutes more. Okay, winding down, the key recommendations are to teach our students to identify these innovative funding sources and to help our people to be resilient, train in health economics, policy, and leadership, encourage interdisciplinary learning. We want our law, our finance, our demography people involved in our programming, and promote culturally appropriate, locally driven strategies. Teach and promote health literacy, social justice, and equity. Right, so leadership, teamwork, negotiation skills, culturally informed policy development, advocacy and diplomacy, opportunities for regional collaboration, and modeling health resilience, which is valuing traditional knowledge alongside modern health systems. Yeah, so in essence, global health programs must challenge the outdated paradigms that ignore the power imbalances and the unsustainable growth and widen inequities, okay? We ignore poor health outcomes are not merely due to chance, disaster, dictators and faith. refocusing on the social determinants of health is important for improving health and reducing long-standing disparities in health and healthcare. To ignore this leaves a critical gap in global health training, and we really don't want to be heading in that direction. So I thank you for your time, and any questions? Prof, have a question? Yeah, always.
No, thank you very much for your presentation. I think it's very clear, and I like that you demystified the concept for us, showing it against other definitions that we're more familiar with than global health. And I think that is very much needed. Certainly down here, a lot of people have been asking. We see the sign at the gate, global health programs, and so people wanted to know a little bit about, where we're going with that. So thank you very much for that. I think that came out very clearly in your presentation. I listened carefully, and, as an institution, there's a cutoff point in terms of how we define success within the global health paradigm. Yeah, we are focused heavily on research, on human capital development, on training, and there are lots of pressures for us as an institution to do more, and we can become, we can get bent out of shape, right. If you may. And so the challenge I see is how we respond to these societal challenges while at the same time delivering on the core mandate of, applied research, human capital development, those things that you touched on in your presentation, curriculum reform, and all of those things that are needed. I'm also aware that you have extensive experience in straddling the divide. You've worked across, and you've managed to work with, regional and local partners. And I wanted to ask if you could give an example of how you've managed to do that. One of these projects that you've worked on that you really liked, and how you were able, as somebody who is operating in the university setting, to bridge that divide. Just one example, yeah?
Well, I should tell you that before I worked in the university, I was heavily involved in health. And sometimes I think it's those connections that have enabled us, or enabled me, to continue to grow my career in education, because the networking that was afforded to me by the opportunities that I had in health is what has really allowed me to deal with the divide. I think it's about partnerships. It's recognizing opportunities when they come along, because I can tell you that the opportunity that I had to work with WHO was a voluntary one initially that grew into something that was more meaningful. And so partnership, looking out for opportunities, seizing the moments, not being afraid to volunteer initially. Once you get your foot in the door, then I think then you have more access. Hope that gives you...
Yeah, definitely. And just a follow-up, sometimes when we think about these concepts that have global in the labeling, it can, push us away from some of the things that are really local. I know you also work closely with adolescents, right? And, I'm not saying that, working with adults is a lost cause. I'm not, saying that any at all. But do you see an opportunity in working with that cohort for how we can, tackle some of the big issues that are the big challenges that are facing our local population.
Most definitely.
Yeah.
Yeah, this is why I think the education around climate change and the impact that climate change has on our community, if known from the adolescent stage, really does stay and impact how our adolescents grow into adults and conduct their lives. Also, there's access to training that I think adolescents more likely to uptake. So I think it's quite an opportunity to teach them, particularly around our mental health issues. If we place a focus on mental health, they become more aware of the signs and symptoms. They become more aware of how to support each other and themselves. So I think, yes, there's a lot of investment that we can make, particularly in climate change and mental health, that can go a long way in addressing some of the long-term impacts that we were discussing around global health and access to health and healthcare.
Yeah. Thank you, Prof. We have a question coming from online from Dr. Tina. From Dr. Tina Hilton Kong. She is asking, how do we present the needs of the Caribbean as a unique scenario amid other global scenarios, especially if we're looking at delivering courses or teaching courses from our institution and for other international students?
You know, I think that's one of the benefits of having our program right here in the Caribbean, that we get a chance to do just that. You know, because though we are doing a global health program, I see this as a global health program that's training leaders for our context and our issues. So yes, to bring, to understand our context very well, and then once we get those partnership opportunities and those representational opportunities, you know, to go volunteer and to write guidelines, then you can bring that perspective. But you have a good, solid understanding of the issues of our context. And, you know, that's why we want the curriculum to be so full, so that they can begin to see the intersectionalities between the different pieces and to advocate on our behalf for change and inclusion.
Okay, thank you. And my question is, global health, or the funding around global health, seem to be coming mainly from NGOs or international governmental agencies. Mm-hmm. How can we tap into the private sector, both locally, regionally, and internationally? What can we do differently, and how do we refocus our thinking? Because we tend to think NGOs or foreign governments, especially from Europe, as you're saying. Yeah. How can we focus, both as an institution or other individuals who are looking for funding?
Yeah, and I really think that's the key. We really are going to have to figure out this funding piece if we're going to have our development programs come back on stream. And I agree with you that involvement of the private sector is a very good way to go. And, you know, I keep speaking partnerships, but, you know, that really is what it's about. How can we let private sector realize that they also have something to gain from their involvement and a lot to lose if they don't? You know, so it's about recognizing that our partners also can benefit from what we're trying to accomplish. So partnerships, that's the way I say we go. We get them on board. We invite them to these sessions. We educate them about what can happen if we don't address climate change, and then we try to make it very specific to their bottom end, which is the money. Okay, if they can see how the money is going to be coming out of their pocket in other ways, maybe they'll put some in ours to help with programming.
Thank you. I don't have a question, more so a thanks for bringing this to the forefront, especially with the changes that are happening now, not only globally, but in Jamaica. I think we have to talk about the strategies that we have to take place. Students, even though they're from Jamaica, come from different backgrounds, and we need to know how to implement strategies that can help them, strategies that can assist them with whatever struggles that they have. So my thing is just to give you an applause for bringing this to the forefront and having us also consider strategies, because it's not just about academic, it's about how we assist them in their health services, how we assist them outside of the classrooms. So I think this is a very well put together piece, and I'm very happy that you brought it to our attention. Thank you.
Thank you very much.
considering where we're located, right, and everything that's happening around us. I hear private sector. We're next to an airport.
Yep.
There's so much. We have the hospital right there, and we have big plans in terms of what we want to do. What do you see as some of our main advantages from a global health perspective, based on where we are and what we can do?
Well, definitely where we're located. I don't think we appreciate the value of stepping out of our campus and being at the airport, about bringing people in for conferences, just continued discussion and collaboration. It's really easy to get to us. As you rightly say, we also are we're renovating our hospital, and we're building a new adolescent hospital. And so what we're going to be having here is state-of-the-art health services, and that is something that we can sell. We can sell access to services, but we can also create teaching opportunities. People can come here and learn how to do particular techniques. And so we need to see ourselves as really the hub. Yeah, and Jamaica has always led. I need to be careful. Jamaica has also always held a leading role, and we will continue to do so by ensuring that we outline to people the benefits of coming here, how easy it is to get to Montego Bay from the rest of the Caribbean and from the United States and Europe, and so sell those. Thank you. Prof, you finished with me?
Finish, huh? Dr. Dixon, thank you for a very informative session. As I was thinking about my question, you touched on the point of partnership, and I was going to ask, what would the best approach be for us to create those partnerships in the health industry, the health sector, given that you've been a part of it for so long? How do you see us approaching and cementing those partnerships?
Yeah, one of the things that really works is personal relationships. I think that once we can recognize that there are personal relationships that exist between people because of the different sectors that they have worked in, it's a good opportunity to bring people to the table to create relationships that are more formal, right? So I would definitely start there. Don't miss out on the experiences that people have because they've worked with John Brown or they've worked with XYZ capacity. It really goes a long way. So that's one way to work on partnerships in the more informal capacity. But then I think we can formalize it and structure it through the letters, the conferences, the seminars, these seminars where we invite people in. I think that's another approach. And then, there is the social gatherings. Do we have a presence there? Yeah. When there is the chamber, are we there? Are we at those chamber meetings or those events? And when we're there, because that kind of talking with people and engaging with people and sharing our ideas really does put our agenda on the table. So let's use them all.
Thank you, Doc. Since you said this presentation was supposed to be done from May, right? So between now and then, do you see us in a more serious trouble now that we have tougher tariff measures, funding, cutting left, right, and center?
Yes, because in May, we were just beginning to understand the implications of all of these cuts in funding, yeah? We didn't know what was happening. There was a lot of, people were frightened, people were uncertain of their jobs. We were kind of hoping that things would pick up and things would change. And then guess what we learned? They haven't. They have not changed. And now we're realizing that programs have actually closed. People have been laid off. And now what it says to us is that we can no longer continue on this path of we're going to have access to donor funding and we can rely on that year after year for our programming. We now have to go out there and find new strategies to find funding. And if that means beginning to understand this economic arena more, then we need to understand the economic arena. We need to understand about tariffs and how that impacts us. and the various points in the economic world that I don't know, right? But one of the other things that I mentioned is that global health is really multidisciplinary. We have to bring everybody because everybody has a perspective and a knowledge and a teaching that's going to help us to pull together our package and our offering. And then when our leader steps out there, because they've graduated from our global program, of course, they have that diversity of knowledge to be able to address the different challenges that comes our way. Okay? Thank you very much. I think you're finished with me now.
Thank you so much, Dr. Dixon, for your very insightful, engaging, and thought-provoking presentation. The discussions, it offered valuable perspective both to clinical practice and the broader implications for global health. So that's an interest of ours, so we look forward to you doing more work in that area and we supporting you 100%. Colleagues, both online and in the audience, I want to thank you on behalf of Professor Donovan Campbell for staying the course with us and engaging in these series, because they're contributing so much to our learning and to our thoughts as we strategize on how to make our campus and our research and our areas of interest more innovative and thought-provoking. He's in the room, so I also want to extend a special thanks to Professor Donovan Campbell for his vision and leadership in making this research seminar series a reality and an ongoing success. And we have a special guest in the room. Yes, Dr. Lee Bailey, we invite you to do a presentation one of these days. We look forward to your knowledge and engaging in the community, of course. Please look out for details on our next presentation, which will be in November. And remember, colleagues, you're all welcome to submit your proposal for presentation. Thank you very much for joining today, and have a wonderful afternoon. And see you in November. We'll announce the dates very soon. Thank you.